Dr. Paul here. I've got a young lady, 2.5 years old, with painful urination. I don't think this one's going to be a big mystery, but let's go see. Hello! I like your outfit. And you've got a pretty shirt too, like you're wearing bling chains and stuff. That's pretty cool. It's got stickers on it. That's great. What's been going on?
Well, this is the third day that it's hurt to go to the bathroom.
Okay.
And she goes every like 30 minutes to an hour and she's had some accidents.
Okay, she's going really frequent.
Yep.
Normally she'd go a handful of times a day, and
yeah.
Now it's every hour or more.
She's usually a camel.
Okay. Any fevers at home?
We hadn't checked, but
okay.
She didn't ever feel.
She didn't feel. No. That's a really nice blankie, isn't it? When you go pee in the toilet, what happens?
Nothing.
Nothing? Does it hurt?
No.
No? Okay. You feel like you're going more often than usual?
No.
No? Are you 2?
Yeah.
Well, you are 2. That's good. For the viewers, we've already actually examined this young lady. Her ears are fine. Her throat has an interesting little finding. Let's say, ah, very good. Yeah, she's good. See the red spots there? Mm-hmm. So when you see those little red dots at the back of the throat, sometimes strep will do that. If you poke yourself with a toothbrush or something, that can certainly give you red spots like that. In this case, we have a urine analysis on DIP. It's 3+ white blood cells, nitrite positive. And when I look under the microscope, we've got 5 to 10 white blood cells per high power field. This is a classic UTI, urinary tract infection, and it fits with your symptoms.
And what are the symptoms again?
The symptoms are frequency, it hurts, it's called dysuria, and you also often experience this thing called urgency. So you just finished going to the bathroom and you feel like you've got to go again. Does that happen sometimes? Yeah, you can agree with me on that one. Okay, so this young lady has had one other urinary tract infection in the past. So for medical folks who are watching, it's felt, we used to do an ultrasound to screen for any problems with the urinary tract system after a first UTI. The latest recommendation is you can wait till your second UTI for girls, first one for boys. Okay, we're gonna draw kidneys. They look like elephant ears, look at that. And then this is the ureter. And that looks like the trunk of the elephant. And then we're gonna draw the bladder. And normally, the opening to the bladder from the kidneys is tunneled into the bladder, but sometimes it's attached directly like this. In this case, if you have an infection, it can go up into the kidneys and start to cause some kidney damage, whereas when it's tunneled properly, even if you have an infection, it can't go up there. So this area of the kidney, called the calyces, will be normal. This might be abnormal. So when they do an ultrasound, if they just put a little goop on your back, I'm going to send you to a specialist, not today, just some other day, and they'll put a little sticky stuff on your back and they'll look at your kidneys and say, yep, they look perfect. They almost always look perfect. It's just, we don't want to miss this.
Check,
yeah. Because then you can, there are these cases of end-stage renal failure that were just missed. They show up in adolescents or young adults, and it's something that could have been preventable if you've got a problem where perhaps the ureter is just attached wrong and they're having a situation of chronic infection. And so we like to identify those, but this today is just a straightforward UTI, urinary tract infection. I tend to go with trimethoprim sulfa as our treatment of choice. Unless you have a sulfa allergy, then we'll do amoxicillin. Amoxicillin gets about 95% of the organisms. Trimethoprim sulfa gets about 99%. So actually, I suppose you could go with either. And of course, we always send off our urines for culture, and then in 2 to 3 days, we know exactly what we're treating. And if we happen to have made a wrong choice on the antibiotic, we can switch. Thanks for watching. I'm Dr. Paul. Thank you so much. You did a good job. You were a great helper. Thank you. So we're going to see you on YouTube, okay? Okay. All right. Thank you so much.